Hello, everyone, and welcome to the EHRA Wrap-ups. We are wrapping up the final day of the EHRA 2026 Congress here live from Paris in France. And for the final wrap-ups, I'm joined here by Stylianos Tsais and Natassia de Gross, the Congress Program Committee Chair and Co-Chair of the EHRA Congress. So welcome.
Thank you.
Thank you for having us.
So, Stelios, it is the final day of EHRA Congress,
It is.
and you've been building this program for months. How do you feel right now?
How do I feel? Exhausted and some mixed feelings of bitter feelings and relief. It was a huge team effort for the last 3 or 4 months, and we have started preparing the program since May 2025. So you can realize it has been a marathon for us, Natasha, myself, and the whole scientific program committee group. And I would like really to say a big thank you to all of them. Indeed, it's a collaborative effort, and also for the contribution of the EHRA and ESC staff that have worked tirelessly in the background, behind the scenes, and they need to be acknowledged for their contribution. But I think the end result is more than satisfactory. You know the names, Natasha, the numbers, you know the numbers. Can you say the numbers? Because I think we should be proud of.
Yes, we've reached over 7,000 attendees.
Great.
Yes.
7,108 participants. So we have broken every record.
Yeah.
And we are very proud to see this increasing trend of attendees and delegates, and really hope that this will keep on going in the right direction.
Thank you. Thank you for those words. I think all of us felt this energy that you also felt during the Congress. Natassia, a question for you. So the last day of Congress also hosted 2 late-breaking clinical trial sessions, hosted a competition on the AI and digital tools in clinical EP. Did you deliberately save the best for the last, or was it just like it worked out like that?
Well, if I take a look at the program, I wouldn't say we saved the best for last. I think at every day we had excellent late-breaking science sessions. There were the clinical cases, there were tracings, EKGs, the award sessions. I think every day we had something special. And by accident, actually, it was arranged like this. So, yeah.
Thank you. So now that we mentioned the late-breaking clinical trial sessions, first session was actually a session on cardiac implantable devices. What would be the key take-home messages from the late-breaking clinical trial on devices?
Well, I can think of the implantation of extracardiovascular devices in pediatric patients. There was a cohort of over 50 patients where they implanted the device. And it was the first time you actually showed it safe. So that is one important message to remember. And the second one was on the implantation of leadless pacing device for patients with sinus node dysfunction, and also sure that the follow-up not too long, but still that the procedure could be performed safely. So I think 2 nice new technologies approached in an interesting population. Yeah.
Indeed. And for you, Stelios?
And there were 2 extremely interesting trials on comparing left bundle branch pacing and CRT in patients with ejection fraction less than 35% and left bundle branch block. The one was positive, the other was neutral. I think it will keep the debate on regarding what is the optimal strategy in order to manage this quite challenging patient category. But I think the more data we have, it will be easier for us to lead to a reliable conclusion.
Indeed, yeah. We do still have some areas in EP that are quite controversial and debatable, but I do think that as much as evidence do we have actually the more conclusions, as you said, Stelios. We have another session, another late-breaking clinical trial session was also on ablation and drug therapy. Can you tell us something more about this session?
Yes, I would really like to put the spotlight on the Ulysses trial, which documented the value of echo-guided femoral venous puncture. So we have randomized data to support this strategy. I think it is intuitive for everyone to use echo in order to enhance the safety of our procedures, but now we have strong randomized evidence. And I strongly believe that these are adequate to officially standardize our practice in favor of adopting routinely adopting this strategy in order to enhance procedural safety. The second was about flecainide. Would you
Yeah,
like
so
to say some words?
flecainide. Yes, there was a study where they compared the efficacy of flecainide in patients with coronary artery disease, so stable coronary artery disease and atrial fibrillation, and they compared it to amiodarone and showed that it's more effective and also safe.
In the emergency department for acute cardioversion. And that was, I think it was a section that we were missing data.
Yeah.
And the CAS trial probably had put aside slightly these 1C drugs, and now we open the door.
Yeah, slowly we are opening the door. Thank you. So we will wrap up now the whole Congress. And Stelios, as you said, we had more than 7,100 delegates. What would be your single or any top 3 messages that should arise from the EHRA Congress?
I think we should not stick on scientific data because we'll probably miss so many information that we had, and we had the opportunity, huge opportunities to read, to follow cutting edge data, scientific data. But I think the key issue is the number of participants, is the energy that we have, and I would strongly urge everyone to keep on contributing to be a part of this huge family that is called European Heart Rhythm Association, because without the participants, nothing of this could have been ever feasible, in order to secure that our association will further thrive. And I strongly believe that this increasing number reflects our strength, which stems from the number of colleagues that we have. And it's impressive that we had faculty from around the globe, we had participants from around the globe, and EHRA is in the spotlight.
Thank you indeed. And Natasja, so did the EHRA 2026 really illuminated arrhythmia management?
Well, that's a problem. If you start to illuminate things, then you also see that things are usually more complex than you expect. So I would say that what we discussed here is also a real source to discuss next year. So yes, it illuminated, but it also rose for new issues.
Thank you. And now you've mentioned the EHRA 2027. What would be your expectations?
Well, if we look now at the scientific content, we see a lot of new technologies. We leadless pacing, we have the rise of AI, we have different kind of catheters for pulsed field. We're still debating how to ablate persistent AF, and I think that perhaps next year we are more moving towards personalized medicine. So we have the technologies, we know how to use them, but now we want to know which patient selection is required for all those new technology, and it might be that next year the focus shifted more to these kind of topics.
And which city will host next year's Congress?
Helsinki.
Helsinki it will be.
And for you, Stelios, what would be your also expectations for EHRA 2027?
Yeah, I think we should expect very high quality scientific data. I was impressed by the quality of the late breaking clinical trials this year, so we could not expect anything less next year. And I think our field is moving fast, and the next year's Congress will capture all the progress that will be definitely happened in all the fields of arrhythmia care, devices, ablation, AI, personalized assessment and management of our patients. So I think it will be an exceptional next Congress.
Thank you. Thank you, Natasja. Thank you, Stelios, for joining me, but also thank you for organizing this amazing conference. Also, thank you, the audience, for joining us, and see you for the next edition for EHRA 2027 in Helsinki from April 11th to April 13th.